and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live again from downtown St. George, Utah. We're super excited to be here. It's definitely a lot warmer than it is in Washington State, where we're from. So we've been having an exciting bike training camp down here for the last week or so, and I'm super excited to finish that off over the weekend. We are even more excited to have CarolAnn Tutera on our show today. She's going to be talking about BHRT and wellness. And of course, if you follow Janet and I, you know what BHRT is: bioidentical hormone replacement therapy. And of course, Janet and I, that's what we focus on. We are experts in that field. So we are super excited to be interviewing somebody else about that. So CarolAnn, welcome to our show.
Thank you. It's nice to be here.
Yeah. So tell us a little bit about your history and how you got here.
It's a good one. My late husband, Dr. Tutera, and I moved to Rancho Mirage, California in the early 90s, where he was asked to put together the birthing center at Eisenhower Hospital. And while he was there, someone came up to him and said, "Hey, how would you like to put in a pellet?" And he said, "Sure, what's a pellet?" So he felt like he found the last piece to his puzzle of working with bioidentical products for females. Before that, he was working with bioidentical progesterone. So while he was helping the physician put in pellets and seeing his patients, the physician unfortunately passed away 3 months later. Dr. T was left with all these patients, and he realized that, wait a minute here, y'all don't wear the same size shoe. So why am I giving you all the same dose? And you're getting too much estrogen, not enough testosterone. So he really revolutionized the HRT world with pellet therapy, because he individualized the dosing of pellets to patients, and he was taking the science and common sense of working with them. They didn't do that before. They just gave everybody the same dose. So I got into it because I heard all these women in the waiting room just going on and on and on about how wonderful they felt, what they were doing there. They were excited to be there. I don't know any woman who's excited to be at her OBGYN office, but they were. And she was a pilot who flew all her friends over from Arizona to Rancho Mirage a couple times a year. And that's how this started, because really one patient, which is why we ended up in Arizona.
Awesome. So what is your background? You have a clinical background or?
Oh, not at all.
Okay. All right.
No, I just fell into this. I'm a little entrepreneur. I actually have a master's in spiritual counseling and psychology. I was a teacher in previous past life. But I grew up with a father who opened up multiple menswear stores. So I have that entrepreneurial spirit as I watched him grow and build something.
Awesome. Janet, what questions do you have for CarolAnn?
So CarolAnn, I'm assuming you're carrying on his work. So tell us a little bit about your facility.
I am. I'm carrying on my late husband's work because I think the field of pellet therapy has really been, it's a word I have to use. I haven't figured out another one yet, but bastardized. There's so many people doing pellets who have no business getting into pellet therapy. So I'm trying to really get the information out there of people who should be doing pellets and how to use pellets properly. Unfortunately, we hear so many people who come to my local Tutera offices in Arizona who say, "I went here, I don't feel right. They just keep putting pellets in me." And that's a problem. So I want to clean it up, because Dr. T felt that every person should have the availability to the best modality and the best method of using hormone replacement therapy.
And now when we speak of hormone replacement therapy and pellets specifically, let's talk about estradiol, progesterone, and testosterone. So how does pellet therapy work in with those three hormones?
Well, we only do pellets that are estradiol or testosterone. We don't believe in doing progesterone pellets, simply because if you've got a bleeding issue with a woman who's got the pellet of progesterone in her, you're out of luck. So he always did it in an oral form. That way you can control how the progesterone works instead. And
go ahead.
The pellets that we use are extremely bioidentical. There are no fillers. There's only stearic acid to bind them together. Other people are putting in a product into the pellets thinking that, oh, this is going to be the bee's knees, so you don't have any extractions. It's not the pellet and how the pellet is made that you're having extractions. It's being taught properly how to do the insertion, which is really important to learn.
So we do hear a lot of patient complaints about extraction or protrusion of pellets. So tell us a little bit about the procedure and why pellets might come out later or get infected.
That kind of piggybacks on what I just said. The procedure is honestly less than 5 to 7 minutes. It's a small needle that, so you numb the area. It's like going to the dentist when they numb the area to work on a tooth. You don't feel anything. It's a small incision and the pellets are placed under the skin. As I said, if you don't know and you've not been taught properly how to put the pellets in and how deep to go into the skin, you're going to have problems. They're going to be infected or they're going to be rejected by the body. And there are some people whose body does not do well with pellets. It's a blue moon and a very odd one every now and then. But the only reason they come out is because they were not trained properly how to put it in. It's pretty simple. My late husband just really took his time and taught everybody how to do this properly because he had so many years and so many patients that he saw that he really perfected that technique.
So one of the concerns that I have sometimes is that what happens to the client that gets overdosed? We've seen that.
Yeah,
what's
and
the experience with that?
We've seen that a lot in the Tutera offices here in town. They'll come from somebody else. The testosterone for the female is sky high. Same thing with the male. There are some people who don't want to touch estrogen for a female, and they only use testosterone. So unfortunately, not a lot to do. You just have to wait for them to go through the process of, the blood going by the pellet like a kid licking a lollipop. If it was an injection that they're overdosed with, you got to titrate that down too. But unfortunately, there's not much to do.
And for patients that pellets don't work, you said it's once in a blue moon. What kind of options do you have for them?
We offer sublinguals, troches, creams, patches. We know those aren't as effective as pellets, but that is a modality that we're happy to use for those patients who say, no, I don't want to do that just yet.
And as far as estradiol, when you insert an estradiol pellet, do you have any problem with continuous estradiol and then breakthrough bleeding?
Not if they're taking their progesterone, and that's a must because the progesterone protects the lining of the uterus, as you both know. If the patient is not compliant in taking the progesterone, then that's going to be an issue. I'm a big proponent. I'm not a medical person, but I'm a big proponent of an ablation. I personally had one. I loved it. I don't have to worry about it. And I know that some offices now are using that as part of the standard of care for their patients as well. But honestly, if you don't exceed that estradiol pellet in a really high dose and they take the progesterone, they should be fine.
And then what do you do for your patients as far as whether that are really active? Is there any restrictions after the procedure? Like you can't ride a bike for a week or you can't do squats in the gym for a week or?
Yeah, we discovered when I was making all these forms up in the late 90s that it's important for females to kind of lay low for 3 days. You can't move the hip because it's the hip that's going to wiggle that pellet right out, which is why some people are getting the extrusion. They don't want to stand around and do nothing. They don't want to lie on the couch and eat bonbons. They want to keep up the active life. For men, it's 7 days. You can walk all you want. You cannot bike ride because you don't want the hip to move. You can do upper weights. You cannot do lower weights. So there are restrictions, but in order to feel good, 3 days or 7 days, that's kind of a minor deal to have to put up with, in my opinion.
And what if the dose is too low on a testosterone pellet, for instance? What do you do? Do you add another pellet, or do you wait 5 months and then do a different dose? Or
No, we're pretty conservative to start with, which is why I like the method my late husband came up with. He always said you can always add, but it's really challenging to take away. So we go conservative. We test your blood levels in 4 to 6 weeks. If you feel and the blood levels look or congruent that you need a little bit more, we always can put in another pellet at the recheck visit. Not a problem.
what about as far as we've noticed with people with pellets? One of the things is no matter how high you get a woman's testosterone or how high you get her estradiol, they still have vaginal type symptoms. So vaginal atrophy, vaginal dryness. What do you do in that situation?
Not being a medical person, I'm sorry, I can't address that question for you. I don't really know. I don't step into that arena, so I don't have an answer for that one. Sorry.
Okay. That's
No,
okay.
that's all right.
Janet, can you go ahead and comment on
Yeah.
that?
So my comment would be that if that's continuing to happen for you, this is something that can be addressed with maybe a local cream that's directly applied to the vaginal tissue. So this can be a problem with women that are doing patches as well, or even taking oral medication. So if you're having a local problem with atrophy, painful sex, just dryness, recurrent UTIs, definitely sometimes a local application to the tissue is warranted. And that would be something I think I would discuss at your visit when you come back in for a follow up, because a lot of times you don't need to do that on a daily basis. It could be every other day or every third day. So those are things that I think would be in a follow-up after your procedure.
And estrogen, not just estrogen applied vaginally, but testosterone. There is not a better drug applied locally to any tissue, for that matter, that is better for atrophy. So we have seen women, their vaginal tissue get much better when testosterone is applied locally. And it's absorbed great that way too, because it's a mucous membrane. So testosterone is absorbed great in the vaginal area.
Terrific. Thanks for answering that for us. Love
Welcome.
it.
I'm sure your practitioners probably do address that in a visit, but
I'm
I just
sure they do.
yeah, I think that sometimes that's a question or something that sits in a lady's mind and is not usually addressed, because even just when they go to their primary physicians or nurse practitioners or PAs aren't asking women the questions are you having any dryness? Are you having any painful intercourse? Are you having any leakage? I mean, that's just not a conversation that seems to happen. But as we age, that is something that I think many women need to have addressed, or even, whether they aren't, eventually they might.
Yeah. Well, I know that we do address the leakage. That's a big part of Tutera Medical also. We have a product that we use from another company to address that issue that's getting great results. I believe it's FDA approved. And I'm sure they address these questions, but also as a female, you may not want to go to your provider and say, hey, I'm still having painful sex. What can you do for me? It's embarrassing, and nobody wants to talk about that. They're
It's
just
true.
not talking about menopause.
Right. No, I agree. I think it's really sad that we don't discuss this with women, especially as we age, because it's been my experience for women that a lot of times this starts to become an issue between you and your partner, especially when both of you are having some changes in your life. So these questions may be uncomfortable, but there are answers for them. And I feel like the more we discuss it openly and let people know that there are things that we can do to help that, I think that opens up a huge arena in their relationships that they have with their partners.
I agree. And I think actually asking the question to your provider is more painful than the painful sex.
Exactly.
So you got to weigh it out. And
Yeah.
as Americans, we're not as open with
No.
our sexuality as Europeans are. They run around naked and think it's great and they talk about it all day long. So we don't.
Well, I think that's one thing that we need to change in our culture, as far in the medical culture, at least, because Jan and I talk on our podcast all the time that, healthy people have regular sex, and sex keeps us healthy. So it's very, very important. And if you can't talk to your doctor about it, then who can you talk to about it? And
Your
that's one of
girlfriend.
yeah, exactly. Right.
Right.
Yeah. Actually, sex keeps people really happy. So
It's
yeah,
true. And it's
that's another part of it too. But you
right.
can't, it's such a taboo to talk about.
Well, I think too, one of the things that we've taken away from some of our podcasts is, when you talk about in relationships, if you have a good sexual relationship, then there's things that you put up with your partner that you probably wouldn't, just because of the intimacy, right? It's like, oh, he didn't put the toilet seat down again. Oh, well, right. But it's also, I think, a form of communication that we fail to recognize in relationships, that there is an interaction that is super important as we age. And I think that especially, it saddens me for perimenopause and menopausal women that could be a problem that has led to the demise of some relationships, that, that flow of communication is just being blocked or not even happening.
Well, I know for a fact that so many husbands come into the office with their wives after they've had one or two insertions, and they say to us, "Thank you very much for giving us back my wife."
Exactly.
It's
Yeah.
not only my wife, but our lives. And it's so wonderful to hear that it's really bringing them back together as a couple. Because I agree. I think a lot of relationships break up over sex. As sad as you want to think that sex is running your relationship here, there's got to be more to it. But that is a big factor that we've got in our consciousness.
Well, let's face it. I mean, if you're not having regular sex with your spouse or your significant other, you're just roommates. You're just friends. I mean, it's really what separates us from being just friends. So it is very important, and let's just not, let's just admit that it is very important. Let's say it's okay. Let's say it's not shallow. It's important, and one of the problems is, I think, as Americans have gotten fatter and less metabolically healthy, is they've had less sex, and
Right.
that's the problem. So we make excuses that, oh well, sex isn't as important as we age. Well, no, it's just because you're aging horribly because you eat like crap, you don't sleep, you don't exercise, and you're overweight, so you don't feel like having sex. So you're going to make an excuse about that. But that's not the way it should be. I mean, when you look at our ancestors, hundreds of years ago, they were having sex until they died, but most of them were metabolically healthy, unlike most Americans now.
Yeah, well, most of them died in their 40s and 50s too. I mean, it depends on how far back into our history you want to go. They weren't living as long as we are. So,
Well, on average, they weren't, because there were people that died younger from certain diseases, but there were many people that lived into their 80s and even hundreds. When I say many, there were, you hear about it. But the overall age was less because a lot of people died younger from accidents and diseases and things like that.
So I think when we're piggybacking on our sexuality, I also think for women, just our overall health of feeling better and becoming or staying active, I think also brings a lot to the table of longevity. What do you see in your clinic with the clients that are doing BHRT, and how do they feel and how is their longevity?
we have some patients in their late 80s, early 90s, strictly with the testosterone pellet, because they want to get up in the morning. They want to get out of bed by themselves. They want to feel good. They're not getting the pellets as often because they're not actively moving a lot through the day. They're going to go out on the front porch, sit in the rocker, and enjoy the sunset and the day and wave to everybody. So, I'm almost 70 years old. I've been on them since my 40s. I won't do anything else since I was introduced to them. And trust me, I was the shoemaker's daughter. I had to go to my husband at the time and say, there's something wrong with me. I've got all these symptoms. So I got put on my first pellet in my early 40s, knocking on the door of 70. And I hope to keep going until I'm, that way.
Right. Well, good for you. Yeah, BHRT is a game changer. And we talk about, um, we get asked from patients often, it's like, well, how long should I be on this? Especially after their life has changed and they're doing awesome. Well, we tell them it's like you're not going to magically start producing your own testosterone, your own estradiol, your own progesterone.
Right.
So if you want to keep doing awesome, you want to sleep well, you want to have awesome sex, you want to be able to get up and have energy and not have depression, you'll be on this the rest of your life.
Yeah, that's what we say also. My question to them is, how long do you want to feel good?
Right.
You know, our bodies are like a car. When you run out of gas, you need to be filled up again. You can't drive your car down the street if there's no gas in it. Same thing with the body. If you've got enough hormone in it to keep going, and as we all know, the pellets slowly dissolve in the body, you've got to refill your own tank.
Exactly.
Just common sense.
So let's talk a little bit about the procedure and maybe one of the side effects that I've heard about. What about scarring? What about scarring when you insert pellets?
We don't have too much scarring in our clinics. You know, of course, you go from right side to left side and you bounce back and forth for every time. There is a tool out there that helps reduce with the scar tissue building up. Unfortunately, I know some of my friends, after they've been doing it for over 25 years, they are getting that scar tissue. You recommend massaging, and then there's the massage gun to help break that up also. I'm waiting to hear. I'm also big into using the red light on my body, and I'm wondering if that's going to be a factor in also helping with the scar tissue as well.
That's an excellent point, because some people just naturally scar easier than others. So I think even for myself, I know when our first son had a surgery, I had no clue coming from the pharmaceutical side of the world that you were supposed to massage the area. So I'm glad you brought that up, because that was something like I learned after the fact. So what happens when someone decides they don't want to have pellets anymore? Do you just transition them to something else, or how does that work for your clients?
Actually, it's really kind of sad. The patient just stops. They don't return your phone call and they don't come in anymore. 9 times out of 10, that's the case. They're their own doctor. They take themselves off pellets and say, that's it, I'm done. For whatever reason. We do see patients come back in a couple of years and they go, I guess I'm not feeling as great as I used to be. Some people we will slowly transition over to another modality of hormones. But I think the majority of them just take themselves off the pellets and they slowly disappear into the sunset.
And do you have? I'm going to go ahead and stream your website here, and I think you guys have a training program where there's clinics that you train where people are over outside of Scottsdale. You guys look in Scottsdale, right?
We are in Scottsdale. My 3 offices are in the greater Phoenix area. We do train physicians. We've been training since the late 90s. We still follow Dr. T's methodology for training. We've done some tweaks, of course, along the way. We are including the brain health now in our training. We've got a multi-patented dosing site we developed. We also do transgender training as well. And we train physicians also internationally. So we are big in Brazil and in parts of the EU.
That's awesome. Well, Jan and I know that, for the last 2.5 decades, we've been helping people, with their lives through hormone replacement. And it's really, really rewarding, because unlike in the traditional sick care system of medicine, our patients actually get better. They actually are able to stop taking their type 2 diabetes drug, their osteoporosis drug, their antidepressant, all these drugs they get off of because their hormones are balanced. And it's just important to get the information out there that there are many ways to get your hormones balanced. And it's important that patients know just to do it. Go to a provider that knows about lab testing and knows about how to make your hormone levels optimal, not just normal. And how to interpret the labs appropriately. So it's very, very important to go to the right kind of provider.
Exactly. And I'm going to piggyback on that and say that everybody should have a base level done of hormones. I don't care what age you are and you think you're maybe there or you passed it, but you get the base levels done. I also know that some of the lab companies have lab levels that are from the 60s because Dr. T was talking to the owner of one of the companies and he did agree and said, yeah, we're really outdated with our lab levels and it takes Congress to get them passed to change them. So we're reading lab levels completely different than what they're reporting on paper.
A great example of that, CarolAnn, is a man's testosterone. Back in the 1960s, an average 20-year-old man, their testosterone was in the 2000s. And now we're seeing 20-year-old men that have testosterones in the 300s, 200s even. It's pathetic.
It is.
You know, and of course, part of the problem is we have, you know, a couple generations of people that lead sedentary lifestyles, sit on the couch, don't do anything besides eat Cheetos and drink beer. And then they wonder why they feel like crap and their testosterone's only 200.
Right.
You know, lifestyle has a major part of it. Hormones are a piece of it, but we preach all the time that you have to, you know, you can stimulate your testosterone by 200-300 points just by getting off the couch, exercising and eating better.
That's right. And I think because our food is so much more processed now than it ever has been, that's a big problem, major problem for people. And we're finding that low hormone levels in the 30s for women now too.
Yeah, it's crazy. It really is.
Yeah.
So it's important that you and I in this field and us, we educate and empower individuals that they can take charge of their own health, and hormones are a piece of that puzzle.
That's right. Absolutely.
So CarolAnn, as we wind this podcast up, what do you have a passion for?
I have a passion for seeing people excited about feeling better. I really like to see as many doctors trained as possible in the right method of using an HRT and the right modality of it. It's like Dr. T always said, I could train anyone to put in a pellet, but it's the managing and dosing. So I want to make sure that all these providers that get trained actually understand why you're using pellets and doing it in the right manner. I want everybody to stay in their lane. That's, you know, I'm finding so many providers now are getting into pellet therapy who that's not their lane to play in. So I don't want to go to my dentist for Botox either. That's same thing.
Right.
That's a very good point.
Right. Yeah. And there, just to follow up with that, there are dentists doing Botox, and there's probably some great dentists doing Botox, but I understand the analogy. That makes sense.
And there are plastic surgeons now doing BHRT. And can you explain that one to me? Because that makes no sense.
Yeah. Right. They should stick to doing plastic surgery.
Right. That's what you got your schooling in. Stay in your lane. So that's what I'm passionate about, cleaning up the field. Yeah. So
CarolAnn, if anybody has any questions, what's the best way to get a hold of you?
Go through our website at, it's a long one, SOTTOPELLE therapy.com.
Easy to find. Sotopelle.
Sotopelle. Yeah. It's Italian for under the skin.
Oh, is that right?
Yeah.
Okay.
Yeah. And we had to put therapy on the end of it because there's a rock band in Italy that is called Sotopelle. Now, I don't know why they're calling themselves that.
Right. Interesting.
Yeah.
All right. Well, CarolAnn, thank you so much for your time today. You've helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So thank you so much for helping us do that, CarolAnn.
Thank you.
You're welcome. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.